As coronavirus cases drop, DHEC says they're scaling back on testing sites across the state. Today, News 19's Julia Kaufman talked to health agency leaders and shares what else DHEC plans to stop doing next month. Julia.
I'm at one of DHEC's free testing sites in Columbia, but soon places like this one won't exist anymore as DHEC transitions to an endemic approach.
The goal for much of this with COVID-19 is, as we recognize it's going to be here with us, but we're aiming to get it endemic.
DHEC's public health director, Dr. Brandon Traxler, explains an endemic is when a virus stays in an area at low levels, like the flu, but is not severely disruptive. Because of recent downward trends in COVID-19 and lack of demand, DHEC is phasing out its drive-up testing sites.
Not only have our cases been decreasing, but our hospitalizations have been decreasing.
The shift in approach is also due to the latest variant being less severe. But Columbia resident Eleanor Langley worries South Carolina is letting up too soon.
We've been quick in the past to kind of let our guard down and think that things are getting better. And then, of course, we find out that that was not the right course of action to take, and that being a little more safer than sorry is really the best way to go.
Langley got a PCR test Friday at one of DHEC's sites. Starting March 1st, DHEC will move away from PCR and ramp up efforts to give out free at-home rapid tests instead.
I like being able to get a PCR test instead of a rapid test because I feel more confident in the results.
When asked if people can trust at-home tests, Traxler says they've improved a lot.
They might not be quite as accurate as PCR, but they're still now extremely good and extremely accurate.
On March 15th, DHEC will also stop reporting daily COVID-19 case counts and will report hospitalization and death data weekly.
We're really shifting more of our focus away from necessarily case counts and more towards indicators of severity.
Dr. Traxler says South Carolina has plenty of supply of these at-home rapid tests, and if another surge or variant emerges, they'll adjust their plan accordingly. In Columbia, Julia Kaufman, News 19, WLTX.
While DHEC is phasing out their PCR testing efforts, several other sites will still be open, like pharmacies and hospitals. And if you're in a county where DHEC is the only PCR test provider, they'll keep at least one testing site open.